Hello, and welcome to the Power Tools for Coalitions webinar series. I am Sarah Walls, our Communications and Program Coordinator at the USBC, and myself and Cheryl Levitovich and Kinkini Banerjee and Tina Sherman are all so excited to have you join us for this session. The Power Tools series is organized as part of the USBC's training, technical assistance, and capacity building support for the network of state, territorial, tribal, and community breastfeeding coalitions across the U.S. Access is free and open to all interested coalition leaders, members, breastfeeding advocates, and to anyone involved in forming or leading nonprofit organizations in the breastfeeding field. And our webinar announcements are sent through the USBC's Coalitions announcement list. This series occurs on the third Wednesdays of odd-numbered months from 2 to 3:30 p.m. Eastern Time, so just at this time. Can we go to our next slide, please, Cheryl? To streamline access, these webinars have been set up as a series so that once you are registered, you will receive announcements of each Power Tools session with the topic and speaker details. We also understand that it may not be possible to attend every single webinar live, so all of the webinars are recorded and archived so you can watch them at your convenience. Or just the slides from this session, and to access recordings and the slides and handouts from past sessions, you can go to the Power Tools webpage, which is linked here, which is usbreastfeeding.org/power-tools. And I'll show you how to get there now on the next slide. To find the Power Tools page from our homepage, which is usbreastfeeding.org, click on the last tab in the menu, Coalitions. The drop-down menu will show all of the webinar series that we host, including our USBC bi-monthly webinars with CDC and our racial equity webinars. Clicking on the Power Tools option will take you to the next page. So today's session has been designed as a conversation about paid leave in the United States, and we would like to make it as interactive as possible despite the GoToWebinar format. So you're all in listen-only mode right now. When we get to kind of our conversation part of the webinar, we invite you to raise your hand, and we can come and unmute your line or give you a virtual microphone. Or you can also, if you would rather type out questions or comments, please submit them through the questions box on your GoToWebinar control panel, which you can do at any point during the next 90 minutes. And then on the next slide, we have some screenshots of how you can do either of those things. You should see the control panel on the right side of your screen. If you don't see it right now, it may be minimized. Click on the orange arrow and it'll pop back out. If you scroll down to the audio section, which is on the right side, you can see it'll pop back out. And if you scroll into the audio section, you can see where you can select phone or computer. And then there's also below that, there's a tab for questions. When you click on it, it'll open a box for you to type in. If you're having any audio or other tech problems during this session, please send an email to coalitions@usbreastfeeding.org, and our staff will be able to help you. So that brings me to today's topic, the state of paid family leave, a conversation. The United States is the only industrialized nation in the world that does not guarantee its workers paid leave, as we all know. In our country, far too many employees go into debt or lose their jobs simply for having a baby or to care for a family member. No one should have to make the impossible choice between their job and their family. Recently, for the first time in our country's history, the Senate Finance Subcommittee held hearings to discuss the paid leave crisis in our country. And as we head towards the midterms, and as the country continues to have primary elections up until November, elected officials and candidates alike recognize that paid leave is a deeply popular and important issue for every single one of their constituents. Today, we invite you to join MomsRising and ourselves for a conversation about the state of paid leave in the United States. For the next hour or so, we're going to discuss the relationship between paid leave and breastfeeding. We're going to talk about the Family and Medical Insurance Leave, or the Family Act, as well as other paid leave legislation and recent state-level wins for paid leave. We'll hear about advocacy action plans. We'll hear about resources. We're going to talk about everything. So, and like I said, this is meant to be interactive and discussion-based. So we welcome your engagement both through raising your hands when we get to the questions part, as well as submitting your questions throughout the time. And I am really excited to introduce Tina Sherman, the Campaign Director for Breastfeeding and Paid Leave for MomsRising. And she can tell you more about herself and her background as she goes through her slides. And so I just wanted to take a quick moment before we begin and kind of talk about the sort of relationship between paid leave and the landscape of breastfeeding support. I'm really excited to talk about this topic in our Power Tools series because it kind of is this workplace piece that also has this important role inside the landscape of breastfeeding support, which I would define as kind of all of the different pieces that impact a breastfeeding family's ability to meet their breastfeeding goals. And having a comprehensive paid leave policy is one really important part, in addition to having workplace accommodations and having affordable childcare and having the support of your community and the support of your family. It's a really important part to help people reach their success in their breastfeeding goals. And that's why I'm so excited to have Tina with us today. So yeah, I will let her talk more about what's been happening with paid leave.
Thanks, Sarah. Hello, everyone, and thank you for joining us this afternoon. I'm going to give a very brief overview, and we're going to open up for conversation and discussion. For those of you that don't know me, I'm Campaign Director at MomsRising, working on breastfeeding and paid leave. I'm also a birth doula, and a mother of 4. And in both of those roles, I know that I can support a mom through her birth and set her off on the right journey. Set her off on the right foot in her breastfeeding journey. But collectively as a society, we must really continue to normalize breastfeeding and make it easier, advocate and fight to make it easier by supporting public policies that empower and support moms to breastfeed. I'm not going to get too deep in the stats. I'm happy to share some later, but the one that always sticks with me is 4 out of 5 U.S. mothers start out breastfeeding, but less than half are still breastfeeding at 6 months. So while we've made great strides in increasing breastfeeding rates, we still have a lot of work to do. And when we talk to moms about, what are some of the difficulties they're encountering, we really firmly see, so we see some of the policy solutions that could help eliminate some of those barriers and some of those struggles. Moms often talk about the lack of access to breastfeeding advice and support, the discomfort in breastfeeding in public, and concerns about working and breastfeeding. And that's really where we feel like paid family and medical leave really comes in. And as Sarah started out the conversation by saying that the United States is the only industrialized country without paid family and medical leave. We do have FMLA, and that currently covers only covers about 60% of employees. It was a great first step. It was signed into law and enacted almost exactly 25 years ago on August 5th of 1993. But the reality is that many workers can't afford to take unpaid leave. And FMLA, again, while it was a great law, it really was just supposed to be the beginning, so that workers could take time off to care for a seriously ill family member or provide care for a new baby. It was supposed to be just the beginning. So currently right now in the US, only 15% of American workers and also 5% of low-wage workers have access to paid family and medical leave. But the great thing is momentum is really building. States and municipalities across the country are passing paid leave in their communities. California, Rhode Island, New Jersey, New York, DC, Washington, and most recently, Massachusetts have passed paid family and medical leave. Massachusetts actually just this year. And campaigns are underway in several other states, including Connecticut, Colorado, Vermont, Minnesota, and Oregon. We know that 82% of voters favor a national paid family and medical leave program. So what would a paid family and medical leave program look like? One that really could support families. MomsRising advocates for a comprehensive paid family and medical leave policy. And this policy would be accessible to all workers, regardless of caregiving needs. It would offer a meaningful length of leave at least 12 weeks, covering the full range of personal, medical, and family caregiver needs established under FMLA. Part of it being comprehensive and covering all workers would also mean that it would be affordable and cost-effective for workers and the government. Also, that it's inclusive when it comes to defining family. And finally, it will allow workers to take paid leave without facing adverse employment consequences. So we really want, would love to see job protection there. Sarah also mentioned excitedly last week, the subcommittee on Social Security had a hearing on paid leave, and it was very exciting. It's the first one, only the second paid leave hearing the Senate has had, and it was a very exciting conversation to really be talking about what the needs are for American workers, and what it really looks like to be providing care for family members. As a part of this conversation, Senators Marco Rubio, Mike Lee, and Joni Ernst are working on a proposal, and so this was part of the conversation. Unfortunately, their proposal would raise Social Security and give income to parents of a new child. It's a little bit like robbing Peter to pay Paul. So awesome, you would be able to have the option to take paid leave after the birth of a new child, but you would be touching your Social Security benefits on the other end. It really just doesn't work for working families. While we're really excited that the need for paid leave is a bipartisan issue, the conversation was a great conversation, but it has really surfaced up since the last election. The truth is the Rubio proposal is dangerously flawed. It asks new parents to jeopardize their future retirement security for parental leave today, and it neglects the majority of people who take leave. About 75% of individuals who take leave for other purposes than the birth of a new child. And so it really leaves out a large majority of the workforce. And again, when we talk about that affordability, this is where that affordability goes really hand in hand with it being affordable for taxpayers and workers and businesses. And so the Marco Rubio, Mike Lee, Joni Ernst, Ivanka Trump proposal really does not qualify as a real paid leave program. So I want to talk a little bit about what some of the benefits are. When we talk about, why do we need paid leave? We know right now that the great thing is because there are several states who have, California being the one who's had paid leave for the longest, we have a lot of great data on the benefits of paid leaves for workers and for businesses. We know that if moms are offered paid leave, babies are 3 times more likely to start breastfeeding and 2 times more likely to still be breastfeeding at 6 months. We know that moms are 93% more likely to return to work and 39% less likely to need public assistance. 90% of businesses show an increase in productivity and employee morale. And finally, just sort of one last piece is that we know that paid leave can reduce risk factors for child abuse and neglect. So the needs for paid family leave are, I really felt like at the hearing last week, the needs were really clear. It was no longer a conversation about what are the needs, do we need paid leave? It really was about what does it look like, how do we enact it, and from our perspective, what is it, what's the way to ensure that all workers have access to a program to take care of the variety of caregiving needs that families face. So I want to talk a little bit about, for those of you who are in states that have active campaigns, I'd love to hear a little bit about what your interaction with those campaigns are. And if before we get there, Cheryl, if you could, for those of you that were at the coalition's convening last year, we did a screening of the film 0 Weeks, and it was actually the first screening, the inaugural screening of 0 Weeks. And 0 Weeks is a movie done as a labor of love by documentarian Kai Dickens, who, when she and her partner had their baby, she did not have paid leave. And so she started digging and learning a little bit more about why that's the case. And the 0 Weeks is her labor of love to raise awareness. And so we're going to show here a clip in just a few minutes, Cheryl, if you're able to bring that up. And I would love to talk about ways to use this as a conversation piece to start conversations in our communities about the need for paid leave, and have folks share their stories. We all have a story of a time when either having paid leave was helpful or not having paid leave caused a real struggle for our families. And I really feel like the film is a great conversation starter for that reason, and a great way to help garner some support and start looking at ways to get involved within enacting a policy. So Cheryl, I don't know if you have that available and ready to share.
Ready.
All right, thank you.
Not the case. I went to work every day and left on my lunch break and did radiation and went back to work.
I ended up working 3 days after my daughter was born.
Guys, I'm so sorry. I think this didn't work wonderfully. Let's give it another try.
I'm sitting here on behalf of anyone else that's actually facing this right now today, whether or not they need to go to work or be able to sit by their husband's bedside, their child's bedside.
Many folks have expectations that the government guarantees them paid time off when they have a family emergency, and that's not the case. I went to work every day and left on my lunch break and did radiation and went back to work.
I ended up working 3 days after my daughter was born. There's nothing we can really do.
My dad, he had leukemia. He was fired. I might not have a job to come back to. I found myself sitting in a cubicle at work while my son is in the hospital really fighting for his life. And that's a decision no parent should have to make.
Paid leave is part of the economic and social fabric of the entire industrialized world. It's Papua New Guinea and the United States in a league of their own.
Every worker in this country will have a life event, an ill family member, a dying parent, or a new child.
Your body went through so much, just giving birth to a whole human being.
We are in the midst of an unprecedented elder boom.
It's proven everyone can use paid family leave, everyone.
I've been working on this for more than 3 decades. Business leaders help break the myth that this is an anti-business policy.
There's costs for doing something, but there's also a cost for not doing something.
We're going to see a growing movement.
Paid family leave.
So unpredictable. We don't know if we're going to have an accident. We don't know if the parent we love is going to need major heart surgery.
You have a child, there's no bonding time with her whatsoever.
Even though I'm the one with the cancer, this life is not about me.
Imagine what happens when those things occur and you discover that you don't have the time off.
We need a serious discussion of family values, real family values.
Why is it that the rest of the world has figured this out and we haven't?
And we apologize for the technical difficulties. I know that wasn't perfect, but I hope that you were able to get a feel for the film. You can check out the trailer. Sarah put it in the chat box at www.zeroweeks.com. But now we'd like to open up the conversation for a discussion on paid leave.
Thanks, Tina. Yeah, so yes, hopefully that gave you enough of a taste of it. Having seen the movie last year, I can say that it is really it is a very powerful documentary to view and really sort of hits the broad swath of what Tina talked about how paid leave can really impact not just babies and moms, but also, you know, sort of the sandwich generation that has to care for their children and care for their parents. It can really impact a broad swath. Yes, so if we can open up for questions, feel free to, again, chat them in the box. Or if you want to hit the little hand icon, we can come over and pass the virtual mic to you. Whatever is easiest and best for you.
Tina, we had a question come in that says, so what is being done now?
So a couple of different things. So at the state levels, there are several campaigns happening in a variety of states. I named off just a few, and so the advocacy community is really working at a couple of different levels. There are states who are not going to sit around and wait for the federal government to pass it, and so we're working very actively in those states to raise awareness and to get the legislation moving and get it passed. And then on the federal level, we're continuing to have these conversations. Again, we're very excited about the hearing. And so to follow up as a direct action from that hearing, we're looking to visit with senators, both who sit on the committee and senators who have not signed on to the Family Act, which is the gold standard paid leave proposal that's before the Senate now. We're as a direct action to the hearing, we're encouraging folks to meet with their senators and encourage them to sign on as a co-sponsor to the Family Act. So there's actions happening both at the state and federal levels as it relates to this legislation.
Tina, this is Kim Kinney. I know that when we have state coalitions who are involved in, state level, exploring state level paid leave legislation, they've often asked for stories and things. And of course, being a resident of California, we have a lot that we can share from our state. But MomsRising has this wonderful collection as well that you're doing. Is that an ongoing thing that you're doing, or is that thing that folks can use and download? So what happens when you don't get paid leave?
Yes, so we do, and I will put in the chat box our story collection. We are constantly looking for asking families to share why paid leave is important to them, whether they have had experience and they had paid leave where they needed to take time off for caregiving, or whether they didn't. And so we're constantly looking for that. I will put that in the message in the chat box. Definitely would love to have folks share their stories, encourage their members to share their stories as well.
Great, thank you. And the value of all care, and it's as I read in one of, I think, Family Values at Work or in MomsRising, it's not just that babies get born, they get sick. So if you're a 5-year-old, 6-year-old, you're taking care of your aged parents. So we really want to get that whole spectrum of experiences and what that means. But this is we were so lucky to see the screening of 0 Weeks at the last conference, and I know that many state coalitions have been showing it. I know Maryland, I think, did. If anyone from Maryland is on the call, this would be a nice time to join in, because I know you all did something with the screening of 0 weeks as well and talking about paid leave in your state.
Yes, if you, as someone at Maryland comes and chimes in, if you're interested in doing a screening with 0 weeks, please reach out and let me know, and I can put you in contact with the director to get. There's several different versions of it. At USBC last year, at the convening, we had the full length 2-hour version, which was great. But sometimes it's not always conducive to the purposes people want to use it for. So a 2-hour might work really well, but you might also want to do a 45-minute or even a 20-minute cut of the film. And I will tell you, all of those are powerful. It just, comes from sort of a slightly different lens, depending on, if you want to have a full panel conversation, if you just want to have a general discussion afterwards. So if you're interested in doing that, please let me know. And I will be happy to get you in contact with the director about getting a cut.
Thanks, Tina.
Tina, Amy Smolinski from Mom to Mom Global wanted to make a quick plug about the new military parental leave program. And I'm wondering, Amy, if you're able to speak up, or I can just read your concerns that you wrote. I think you're self-muted.
Hey, Cheryl, can you hear me?
Hi, Amy. Sound good.
Okay, good. Sorry, I'm on a beach in Croatia right now, so apologize if it's a little noisy. But so we have just, after a year, finally received the policies from each of the service branches except the Army on the military parental leave program. The Department of Defense, after last year's new guidance, which was confusing, came out with clarification, and all 4 of the 5 service branches have come out with new parental leave policies, and we are happy to see that the military is now acknowledging that parental leave is a necessity. However, family leave for other reasons is not covered under that program because the DoD already has an emergency leave program that applies when there's a need for family leave because of, a health crisis in the family or sick leave. So it's not completely comprehensive. We are concerned because although it does extend, basically the military leave program has established 3 types of leave now. There's maternity convalescent leave, which is for a birth parent, and then there's primary caregiver leave and secondary caregiver leave. Our concern is that under the new policy, only maternity convalescent leave is mandatory. Primary and secondary caregiver leave is left up to individual commanders, which means that you don't have to get it approved. They don't have to approve it. They can say, nope, you need to come back 6 weeks after you gave birth, or they can say, nope, doesn't matter that there's a new baby in the family. We need you at work, and you don't get any leave, any caregiver leave. So we were disappointed about that. And like you were mentioning, there were other concerns that babies aren't just born; they also may have health issues. One of the things that was really concerning to us to see was that if a child is born and then dies, then caregiver leave ceases. You are no longer eligible to receive caregiver leave. You are eligible for bereavement leave, but that then becomes chargeable leave rather than the caregiver leave, which is non-chargeable, doesn't count against your annual leave. So there are some problems with the military parental leave program. We also were a little alarmed to learn from the National Partnership that should the Family Act pass, military families are not included in the Family Act. In fact, the email I got from National Partnership, which I'm not 100% sure I understood correctly, but I think what they said was that no federal employees will be covered under the Family Act. So that's something that we were concerned about, and we were hoping we could get a little more clarification on this call, because obviously we really want the Family Act to pass. We want everybody to have access to family leave, but that includes military and federal employees as well. So I'm wondering if there's somebody there that might be able to answer that question.
Amy, it's awfully nice to hear your voice, even though I'm jealous that you're on a beach. I do not know the answer to that question, but that is something that is incredibly concerning to me, and I absolutely want to inquire. So I'm gonna put that put a pin on that and inquire about that, and I will follow up with you specifically, and we'll also get a wider out to everyone else who's on this call, so that everyone knows the status of that.
Do you know of ways, we sort of talked about individual action. Do you know about any sort of current organizational sign-on letters supporting the Family Act, or any other organizational actions that folks in their coalitions could take?
That was a question about organizational letters. Is that correct?
Mm-hmm. Yeah. Mm-hmm.
Yes, the National Partnership for Women and Families has an organizational sign-on letter going on, and I'm trying to think if USBC USBC was circulating the National Partnership one, and currently the paid leave constellation is currently drafting 2 different sign-on letters for paid leave, one specifically for military families, and the other one for paid leave in general. So know that both of those are in the works, but I will share in the chat box here the organizational sign-on letter for the National Partnership for Women and Families.
Thanks, Tina. This is Kinkini. There's another question about, are there any upcoming town halls that are being organized? And if so, how can we, where would folks know about it? We will post, of course, at USBC through our As We Know, but any other direct ways in which that they could join?
We don't have one currently. We did have one leading up to the hearing last week, but there is not another one scheduled currently. But we will absolutely, as soon as there is one scheduled, we'll ensure that that information gets out through USBC's Weekly Wire.
Thank you.
I would love to, as we're seeing if there are some more questions, I would love to know if there are coalitions who are currently working with some of the active campaigns that are going on. In my experience, I've worked on a variety of, I work in a variety of states on a variety of campaigns. And so I'm seeing here and there that coalitions are involved, but I'm curious as to if there are folks on the line who aren't involved and who are looking to get involved, or have been involved in what their experience has been, if they'd like to share that to the group.
If anyone's speaking, we can't hear you, but we can, feel free to raise your hand and we'll unmute you so you can share, or share in the chat box as well. I know that I've seen a lot of action from the Connecticut Coalition working on paid family leave. Unfortunately, I think their legislative session has recently ended.
Yes. No, and I know that some organizations are also concerned about what does being an advocate mean? And know that it's really about sharing your story. And it could be more than that, but really what lawmakers need to hear are the stories of real families and what their experiences are without or with paid leave. And so, again, going back to the everybody has a story. So depending on the capacity of your organization, it could just be a matter of, sharing stories. You can do that in conjunction with MomsRising. You could do that in, showing up for a hearing and testifying, written testimony, meeting with lawmakers, sending a letter to the editor. So it could really be as involved, or signing a petition. So it could really be as involved, or as as sort of hands off, as much as, or as involved or not so involved, depending on the capacity of your organization.
And this is Cheryl. I serve as steward for the Workplace Support Constellation. And of course, there are so many connections between paid family leave and workplace support upon, the end of a woman's leave. And we definitely are seeing a lot of benefit when we really, just like the way Sarah packaged in her introduction of saying, like, this is part of the comprehensive package, this is part of the spectrum of support. Do you feel, Tina, like that's been a helpful strategy on the paid leave side? Because I always have this concern about if we make it longer than about, the 12 weeks and then bring in the accommodations conversation, does that kind of scare employers away, or is that a helpful approach?
I think the one thing MomsRising likes to say is we don't lead one issue lives. And inevitably all of these are issues that need to be addressed, and whether it's addressed in a particular policy package is remains to be seen, but we should always have the conversations of what families need. So I would say err on the side of having those conversations, and then if we're highlighting paid leave, definitely stress that, but just err on the side. Absolutely. We're not one issue. We don't live one issue lives.
I like that line. We have a comment here. Minnesota has 6 weeks paid leave for state employees. That was just included in the state employee contract. And Linda noted that this was a coordinated effort through the state employee unions.
That's amazing. Congratulations. And every one of these wins, that's one more win. And that's one more win that goes to the momentum that's building. So that is amazing. Thank you so much for sharing that.
Thanks, Linda, and yay for collective bargaining.
Yes.
Tina, I had mentioned it in the introduction to talk about that the midterms are coming up. And so what are some ways that, as there's sort of like this bipartisan focus, and there's also some confusing things now for legislators about paid leave and how there's good paid family leave and not so great paid family leave, what are some ways that advocates can make sure that their candidates that they are constituents for know and can focus on good paid family leave?
The key really is, so if you're have the opportunity to talk to candidates running for office, the key really is a comprehensive paid leave policy that covers all workers for a variety of caregiving needs. And I realize that's a mouthful. I wish I could say it in less than a mouthful, but the key really is a comprehensive paid leave program that covers all workers is really the key.
We have a note here. Robbie, you have a question and your line is unmuted.
Thank you. I was wondering, Tina, are there specific legislators that need to be targeted?
Yeah,
we could do that in California?
Yes, so there are two different sets of targets. The Senate for members who are serving on the Finance Committee, the Senate Finance Committee, as well as any member of Congress who has not signed on to the Family Act, either in the House version or the Senate version. And with that said, I'm sure that I can, I'll pull up here the list of senators on the Finance Committee, but I can assure you that there, while we have members, while we have signatures or co-sponsors of each bill, both in the House and the Senate, it is not a robust list, and so we can absolutely reach out to those members of Congress to encourage them to sign on.
We are getting lots of notes about how helpful you are, Tina. Thank you so much.
Thank you. Well, for anybody who is looking for additional information, I'm going to put one MomsRising link in the chat box that gives, I will say it's only as recent as, I guess, the middle of session for many states. But I'm going to put that in the chat link. And also feel free to reach out to me at, my email address is tina@momsrising.org. So feel free to reach out to me there, and I'm happy to kind of direct or give additional information as needed. But I'm going to put right now in the chat box the larger link that talks about sort of where things were, again, while it's session. This was a blog post that was done in April, and so it's a couple of months behind, but it will just give you an idea.
Cheryl, are you able to show that page? Like, are you able to click on that and show that, or some of the MomsRising paid leave sections? Thanks.
Oh, sure.
Oh, thank you. Look at that. And if you are interested in getting a little more involved on paid leave and the campaigns going on, we do have a constellation at USBC that I'm a steward of. So please look into the constellations and join us. There's many, lots of great folks on the constellation, and we're all looking at ways to raise awareness and to move paid leave both in the states and at the federal level.
Does anybody have any final questions or comments before we wrap up today? This is really a nice opportunity to get Tina's private ear as the national expert in the USBC network.
This is Kinkini. I think we'll continue, Tina, as we get from the paid leave folks, from you, from Family Values at Work, as we see more op-eds coming out, press coming out. We'll be sharing it through our learning communities with our network, and galvanizing for any kind of action building that's happening. But I know that many who could not be on the call today will be wanting to know about this as well and access the recording.
Sounds good. Thank you, Kinkini.
Looks like we have one last question, just to talk about how we can increase fathers that take parental and family leave. So to also do a little spin about paternal leave.
Oh, that is such a great question. Thank you for asking that. That again goes to needing a comprehensive policy. We really want to normalize caregiving, and right now, women end up being the majority of caregivers. And when we talk about having men take parental leave, but also they are going to be in situations where a member of their family may need to be cared for, and being able to normalize that caregiving is a part of a worker's sort of work cycle, and that that need is there. Having a comprehensive program will really help to make it just be a non-issue for fathers taking parental leave, and as well as other caregiving issues. And there have been several studies that show just sort of having that access. I'm sure many of you have heard some of the studies that show that increased bonding, dads are more likely to change diapers, and to remain sort of involved in those critical, difficult first few months of parenthood, if they have that time off. And so having a comprehensive program is really a great first step in allowing fathers to feel like they can, because it's not just an expectation, a societal expectation that the mom is going to take off. So thank you for that question. That's a great question.
I think the National Partnership for Women and Families also released a fact sheet on fathers and paid leave just last month. I think I'm going to put that link in the chat box. And then, of course, they also have a toolkit as well. But I'm going to put that link right now in the chat box.
Thanks, Kinkini.
Sure.
Okay, so once again, also thank you, Tina, so much. It's just always really exciting to hear you talk about paid leave and be able to just jump from topic to topic on this really broad issue. And it's just so fun. And like we said, to get in touch with Tina and talk more about the campaign, she's Tina at MomsRising.org. And just thank you so much. Our final USBC update is that we are 2 weeks out from our 8th National Breastfeeding Coalition's convening, and we are so excited to be moving to Atlanta this year. Our registration is open. It's going to be held August 4th through 5th, with the membership meeting and some regional meetings and a welcome reception on Friday, August 3rd. We are just so thrilled to host this again, and we're excited to bring together advocates from across the first food field to catalyze policy and practice change. It's the only national event for state, territorial, tribal, local, and cultural breastfeeding coalitions and national organizations to connect with each other, and we hear again and again how valuable the in-person time is. So if you are planning to come and you haven't registered yet, or if you are thinking about registering and have more questions, please reach out to us, and please, we would be so excited to see everyone that we do see in Atlanta. And I think that just brings us to the end of today's session. The work we do is all about partnerships. It is about coordination. It is about collaboration. It is about bringing all of our voices together to make paid leave a reality in the United States, a much, much needed reality in the United States. And once again, many thanks to Tina and for all of you do to improve the lives of women, children, and their families in the U.S. Thank you so much.
Thanks, everyone.